located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health, well, that's heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, hey, a lot happening today. It is a Friday version of the show. Our rains have finally left us. Things are brightening up out there. Good weekend in store. Normally, we like to let you create the show on a Friday version. I'm hoping you participate today because there's a lot to talk about. I'll put out a question. Many of you will know exactly what I mean. When I say this, if you don't understand the question, you stay tuned and you'll find out what that's all about. Here's my question. Is the fountain pink again? Hey, if you know what I'm talking about, you know what we will be talking about today. And I hope to bring to you some interesting new approaches to considering the issue at hand, and as well you might know what it would be. If you don't know already, the second clue is it's October 1st. Well, we'll get back to that. And in the course of our discussion today, and we are allowing you to come on in here and set the agenda and bring up anything on your mind, whether it's pertinent to what I'm happen to be discussing or not. 412-825-6262 is the number to do that. That's 412-825-6262, and I'll give that number additionally throughout the hour. Now, calendar-wise, let's bring you up to date on some calendar issues. We've turned the page. As we now well know, it is October 1st. We're into a new month. New scheduled guests are up and coming. The first guest is going to take to the airways with us on Monday. Not a first-timer. She's a second-timer. And she brought a great message to us last time that she was with us on something called nasal washings. She invented a system to do that and accomplish that called NasoPure. I'd like to hear from a lot of you out there who purchased the product and see how it's working for you. More from Dr. Hannah, her name actually Dr. Hannah Solomon, a pediatrician who helped develop that system. She'll be with us on Monday. Then on the 11th, certainly we will be exhausted waiting for the arrival of Three Rivers Thermography here, talking about, of all things, thermograms in this month of what will be continually heard as of a rush to getting mammograms. Then I just booked the other day, we talked about chronic pain. We do so much of it here, acute and chronic pain in general. I mentioned a device. I'll be talking about it some more. I think this device is so unique. It needs to have its own spotlight. The device is called Matrix. I spoke of it a little bit on our last show. I'll speak of it somewhat in the up-and-coming shows, getting you ready, however, for the gentleman who really so spearheaded the most important accumulation of information on the use of this device called Matrix. If you do have pain, and whether it's acute or chronic, I can say this much, you can get substantial relief from that pain through this device. More to talk about it with Peter Beltran when he comes here with us on the 13th. We're trying to arrange a back-to-back show with Dr. Frank Crusay, who runs a large pain clinic operation outside of Akron, Ohio, and he'll hopefully be able to support much of what I've seen. I'd like to compare my numbers and impressions to him. A lot of work this month talking about pain, and especially a unique device very rarely found. I mean rare. It is around, but you got asked specifically for it, and there are no substitutes, although there are many who portend to be such. Then as we move into the third week of the month, we're going to be talking about national, the guest up at the Freedom of Choice in Cancer Therapy group, and that will be on the 21st. That'll be at the Days Inn, just south of Butler on the right-hand side of the road there, 7 o'clock. We hope to have Bill Henderson with us. Written a book on the alternative treatments for cancer, and as such, it should be an interesting week. I'm very much interested in these alternative treatments. Let's see what he has to say about it. So that's how the month of October shapes up. Don't forget, I just heard a chirp, meaning we do have a knock on the door. Come on in the store. Hello and welcome aboard. Hello.
Dr. Courtney.
Yes.
Hi. Hey, I have a question. My wife was diagnosed with Lyme disease here the other day, and I wondered if you have any suggestions or what you would protocol you would use.
Well, if it's early Lyme's, I actually am okay with the conventional treatment of it, because in early Lyme's, we're talking about a bug, Borgatella, which is a rough organism that actually has a metamorphosis that it goes through. And when it's in its bacterial state, the antibiotic regime that's out there is actually quite potent and quite active. The problem becomes if it's able to evolve further in its metamorphosis to its other states, in which that antibiotic approach will be, well, not very helpful at all. In fact, it will not eradicate that bug. So,
it's a couple months into it, so she's getting rashes on her skin and stuff.
Well, there's a very much, they're called target rashes, bullseye rashes. You know what I'm talking about.
Right.
And it's a telltale sign for sure. I'm saying you're late on this one because I venture to say, although I'm not sure about when the evolutionary stages, when one stage ends, the next stage begins, I'll just tell you that with the approaches that we would take, that would not be using antibiotics, I usually don't see people in early stages. I find those people who don't respond to conventional treatment because they got there too late, to continue to have symptoms of Lyme's. Those are the patients that I get. I'm not used as an emergency room stop, so I'm much more familiar with the case as it moves on. I will tell you that there are great non-toxic antimicrobial approaches. They're intravenous, but they are wonderful and they will do the job. So if it's early, stick with the conventional boys. I think it's a very appropriate way to approach it. But if it's later, and this disease is known to take off and take many months to years to resolve. In fact, some never do, because once it's out of the antibiotic killing stage, the conventional medical community is pretty much shut the wad on that one. Okay?
Okay, well, I think if she's taking the antibiotics now, I guess probiotics is a good
well, just because anytime you take antibiotics, you are going to wipe out the gut. The good flora is going to go. You're going to need to replace it. Yes, that's a standard. Probiotics is absolutely an appropriate thing to do. You need to see the response. We hope that your wife is responding. How long has she been on the antibiotic therapy?
It just started today. As a matter of fact, yesterday she started it.
Okay. Well, you've got about a 2-3 week experience on the antibiotics, and you should see a response.
Okay.
If you got this thing at its bacterial stage. That little problematic organism, however, evolves. And once it's out of that state, the antibiotics won't touch it.
Okay, we'll see what happens then. I appreciate it, Doc.
Thank you for the call. I hope everybody benefits from the answer.
Thank you.
Sure. Okay, here we are. I'm putting out the blurb once again, as I did right at the beginning of the show. Last year we were really lucky because someone who drove a truck was coming through Pittsburgh and was listening to the show and reported, yes, this was last year, the fountain is pink. Now, if you all don't know what I'm talking about, if you think I'm talking in code, then let me just bring you up to speed. Today, October 1st, is the beginning of National Breast Cancer Awareness Month. And here in our town, and I'm sure every single town tries to illustrate and emphasize the fact that there's one full month now to encourage women to deal with the issue of breast cancer awareness. Unfortunately, fortunately, I do agree. I think really we should have a time when women do focus on the issue of breast cancer awareness and how best, and here's the part that's going to probably differ from the company line, how best that awareness should be pursued. How is it that a woman should be able to gain the confidence in knowing that she is breast cancer free, or if she does have an active lesion, how best to proceed with that lesion? Here's where, well, we've always been at odds with this. I've often said that when the fountain turns pink, I turn red with enragement, because it has been a pretty much a standard practice to then automatically take off from breast cancer awareness, which is a good thing, to then channeling, herding, huddling women into receiving mammograms, which really do not and cannot come up with the kind of breast cancer awareness soon enough to justify their use. Now, I've been on this issue for many years. Those of you who follow me and have been listening to this show can probably recite what will probably transpire from me throughout the course of the entire month, because I do it all year. Mammograms are not cracked up to what they've been proposed to be. They actually probably tend to provoke the very cancers they're trying to prevent. I thought it was interesting. I dialed up the website for the National Breast Cancer Awareness Month website, and interesting little things this year come up. Let me take you back to 1 year ago. I thought it was a travesty that was perpetrated on women back then, because at the time when Breast Cancer Awareness Month occurred and the fountain turned pink, they certainly did their best to huddle women in to get that mammogram, as they all have always done. And they did so. I really can't say whether they were aware of what was coming around the corner or whether or not it is actually something that was sprung on them. Either way, it certainly didn't look good last year, when after one full month of browbeating and bludgeoning women to consider doing mammographies, which I had said then and have been saying for a while, are absolutely worthless. You'll see what I mean by saying that in just a moment today. That when it was all over, we had a 1 month of reprieve, not much talked about, and then the big thing hit. The recommendations coming from the federal government that you don't need to do mammograms, you shouldn't do mammograms anymore, and that they needed to completely change the schedule concerning mammography, because, as they admitted, the mammogram is not cracked up and cannot produce what it claims it does produce, and it all came down to one salient point that could no longer be ignored by the scientific community, and that is one study after another, after another, after another, and then some, still revealed that there was no difference in survival rates, no matter who did the study. There was no difference in survival rates for women who got the mammogram versus those who didn't get any at all. Now, that's a pretty heavy statement to have to deal with. To their credit, and we'll talk a little bit about that group in a minute, they did deal with it. It created a furor out there. Women who were quite upset, I believe, because they are completely misinformed to begin with. They don't understand the limitations of mammography. They'll talk to you about the fact that they themselves or loved ones are surviving today because they had the mammogram. Well, that's a debatable issue I'd like to get into. But nonetheless, it really did raise the ire of a lot of women and women's groups. Now here we are, 1 year after the fact, when the new guidelines have certainly been published, and yet we have Breast Cancer Awareness Month, which I think is a wonderful idea. But I think what has happened is that we're going to have the same hoax perpetrated with respect to that mammogram that we had last year, that we had the year before, that we had the year before that. I will say that on the website, the NBCAM, the National Breast Cancer Awareness Month Board, has this little blurb, which I'll tip my hat to them for including. Here it is. I'll read it word for word. Sort of creates a question, do I still need my annual mammograms? And so the NBCAM board of sponsored members respond to this thing called the USPSTF recommendations. We'll get into what UPSFT means, but those are those new recommendations, which said women before the age of 40 to 50 shouldn't get mammograms at all. Here comes the blurb. United States, USPSTF stands for United States Preventative Services Task Force. This is a governmental group that brought forth those new standards back in December of last year. Their recent recommendations on mammograms have created some, they say, confusion. Interesting term. They didn't create any confusion. You folks are creating the confusion. They came to you with science. You come back with platitude, and you call them confusion creating, which is, it just drives me crazy. Click below to see how the NBCAM Board of Sponsors members have responded to the record and set the record straight. So they have created the phrase, boy, there must be some confusion out there. And so why would you be confused? Well, the reason that you would be is finally a scientific group had to come across with a response to just completely bludgeoning women with this issue of getting a mammogram each and every year, which is exactly the position they took then, and it continues to be the condition they take today. Essentially, talking about this, the U.S. Preventative Services Task Force, here were the recommendations that they put out on November 17th of last year. Actually, it wasn't in December. It was, boy, that's even worse. The National Breast Cancer Awareness Month ended on the 31st, and 17 days later, the group came out with these new recommendations. Here they were. UPSTF, I'm going to get this right. USPSTF, that's the Preventative Task Force, recommends against routine screening mammography in women ages 40 to 49. That means no mammograms in that age group. None. The decision to start regular biennial screening, that means every 2 years, mammography before the age of 50, should be an individual one and take patient context into account, including the patient's values regarding specific benefits. This is a sort of getaway clause that has allowed the cure to continue. UPSTF recommends biennial screening mammography for women aged 50 to 74. And the final recommendation, which also was one that startled everyone, which was the task force recommended against teaching breast self-examination from that point on. Now, I've now tapped into the American College of Obstetrics and Gynecology, and they have a different set of recommendations. Based on what? I'm not sure. I'd say it's clinging to tradition, clinging to whatever other things they want to cling to, but essentially, point for point, here's what they say. Screening mammography every 1 to 2 years for women ages 40 to 49. So they completely reject the concept that women shouldn't even concern themselves with any mammograms in their 40s. Point number 2, screening mammography every year for women ages 50 or older, not biennial. And point number 3, with respect to breast cancer self-examination, they say that BSE is what they call it, has the potential to detect palpable breast cancer and can be and should be recommended. Completely flying in the face of scientific research. So I'm going to bring you some of that research today to try to maybe highlight why such confusion really exists when one follows the literature, as I believe it's safe to say that the task force finally had to do. I mean, they could no longer ignore study after study after study that showed that women who got mammograms versus those that did not, with respect to breast cancer, there's no survivability changes. The numbers, how long someone lives from their diagnosis, remain the same. And that's what I believe we're losing sight of, and that's what I hope to refresh today in speaking to you. Why don't we do this? Let's take a brief break, come back, and I'm going to get into some of the nitty-gritty on why the task force really should be saluted. Actually, I have some problems with it, but I think that the controversy brings forth the real salient point about mammograms not being cracked up to what they have been purported to be, and I intend to knock it down a bunch more pegs before the show is over today. Women, stay alert. Hey, anybody driving through Pittsburgh? Is the fountain pink? I don't know. How about giving us a call, 412-825-6262. Anything on your mind is okay with me. Be back in a moment.
It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. Confusion sounds fair to you. Give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-982-3002.
Have you been to the doctor lately? What's the big top of your complaint list? Even if your doctor asks you what to eat, the recommended 5 servings of fruits and vegetables a day isn't free in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? Right? Fruit the Spirit. The blessings of Fruit the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit the Spirit, a blessing for your good health. Fruit the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard on this Friday morning version of the show, it is a get 'em up out of town version of the show. You still can come on in and get off your chest whatever's on your mind. What's on my chest today, I'm getting off because it's on my mind. And it happened to do with the beginning of this month called Breast Cancer Awareness Month. I think the breast cancer awareness part of it is absolutely appropriate. I want women to know about their breast cancer risks, and I want them to actually be able to know that they have no breast cancer on board and should feel comfortable about whatever studies they're using to try to bring them to that point. Mammography is not that study. Let's talk a little more about what the push to mammograms, when that's what's going to be happening this month, pushing women toward getting mammography, flying in the face of even the new recommendations put out by the task force, the United States task force, from the proceedings of last November 17th. And it was found in the Annals of Internal Medicine, and the U.S. Preventative Task Force did nothing more than bring those to the public's attention back then. Now, this issue about breast cancer is very interesting. If we keep a couple of points in mind, and if we use these, it becomes almost inconsequential about what the OB-GYNs are going to do, how the radiologists are looking squarely at an economic situation for them, because they're the ones that do the mammograms. And I got a feeling that it weighs heavily in their mind to continue to support the old recommendations instead of the new. But what is it about these mammograms that finally couldn't be ignored? I think that is not what's explained. I believe in the explanation that I'm going to use. I've used it before, but if you're confused, women, follow me point by point. Let's start talking about why is it that I can be so emphatic, and I am emphatic about the poor performance that mammograms have brought in since they were brought into being in the 1950s. This is a study that hasn't changed in over 60 years. It's the same study. And I don't want to hear about, oh, we got digital machines now. Yeah, digital. What that means is you can take the study in Pittsburgh, have it read on a yacht floating in the Caribbean because it can be transmitted over the airways. That's what digital means. There's no clearer picture. It's still X-ray being shot at the human body over and over and over again. Now, how about this for a statement? I don't want you to take me wrong when you hear it, but it's an absolute fact. And the fact is that nobody has ever died from breast cancer. Now, I don't say that really tongue-in-cheek. I actually mean it. Nobody has ever died from breast cancer. The breasts themselves are not vital enough organs that can snuff out one's life. It never has been an issue of the breast cancer found in the breast. The issue is, where has the metastasis gone? Has this spread metastatically? And has, in that metastatic spread, the cancer moved to a vital organ? I say the two biggies are brain and lung. I'll even throw in there a third, which is liver, which is a little less important in terms of the vital nature of that organ than the other two. But nonetheless, nobody has ever died from breast cancer. They have always succumbed from the metastatic consequences of that mother lesion, admittedly beginning in the breast, but it's where it's gone by the time this study is brought into play that determines what the status of this individual will be. Now, there's a rule. You've heard me mention it many times. If you haven't heard this rule before, take heed of the rule, because every time I bring a guest on board who's a cancer expert or purports that they do something with respect to cancer, I always run this rule by them, and I've never had anybody refute the rule or claim that that's an erroneous statement. Here's the rule. A rule, by the way, which you'll never find written in any medical textbook at all. But yet, when I have a conversation with my colleagues, when I have a conversation with radiologists, when I have a conversation with OB-GYNers, they'll listen to the rule that I guess I formulated. They'll take a moment and they'll go, you know what? You're right. Yeah, I have to agree with you on that. And here comes the 1 millimeter rule. It is the greatest salient point for why mammography is not cracked up of what it should be. It will leave you short in being able to ever use mammography to get to the point where it can diagnose this cancer before it has metastasized. Here's a 1 millimeter rule. Anytime a malignancy has attained the size of 1 millimeter, that's about the size of the tip of a pen. Anytime someone has ever had a cancer which has attained the size of 1 millimeter, at the size of 1 millimeter, it is already, I say, off to the races. It's already metastasized to where it is not known, For sure, the lymph nodes more than likely being nearby. Well, nearby should and could be considered to be the first place that metastatic spread can occur to, but it does not have to be. It just means that by the size of 1 millimeter, the metastatic spread has already occurred. With that point being made, and you got to trust me, folks, that rule holds up. It's not written anywhere, but it holds up with all my colleagues when I speak to them. What you need to know is mammograms never are able to catch a malignant lesion at the size of 1 millimeter. It's just not in the cards. It just doesn't happen. It's too small to have mammography pick up that lesion at that size. I'm told, and I've not found many people who disagree with me, that about 1 centimeter is probably the area, the realm, where breast cancers can with a surety start to pick up lesions. This is in certain type of breast tissue, by the way. As you know, we have the term dense breast tissue, which the mammogram is absolutely not going to be helpful at 1 centimeter either. And women out there, you know who you are. You would do best to absolutely avoid mammography and use sonography if you're going to stay within the context of the conventional medical community's approach to cancers, because a mammogram is not going to be able to detect a lesion in a breast that is extremely dense in tissue. It will be well beyond the 1 centimeter that is set aside for it. So, because of the fact that mammography cannot, I repeat, be a reliable tool to detect a mammogram, a lesion, a malignant lesion, early enough to matter, this is why the scientific community, that task force, finally had a man up, better said maybe woman up, and take on what the research had told them, that whether you do the mammogram or not, the survivability rates were the same. Why? Because whether you do the mammogram or not, the metastatic spread, not the original mother lesion in the breast, it's the metastatic spread, and the metastatic spread only, that is what really counts, because it's the metastatic spread depending on the organ that tissue lands in and takes hold and grows and prospers. It is that tissue which will determine the life expectability of any particular patient. So, knowing the 1 millimeter rule, and knowing that mammograms can't produce and come across with the assurity that one would hope and think that it already has the ability to do, this is what the major problem with the use of mammograms is really all about. Don't take into account for the moment, although I would like you to take into account, the other two things that I think should go hand in hand with looking at mammography as, looking at it with disdain, looking at it with the level of scientific respect that it deserves. In its day, it was all that there was. There was only mammograms in the 50s. We're in the new century. We're in new millennium, and we have other ways. We'll talk about some of those other ways, if not today, then the rest of this month. Today we're focusing in on the foible of mammography. I say there's one word to describe another very distasteful component to mammograms. I use one word to describe it. Every time I ever use it with my female patients, they know exactly what I'm talking about. The word is squish, and I'll let it go at that. These are, as I've observed them to be, because I've seen this study perform many times, barbaric, to say the least, in terms of the compression used on the breast tissue to get an accurate picture that they claim they need to have in order to have the study reveal, if it can reveal, the lesion of it to be present. So that word, squish, has its own importance to each and every one of the women that I speak to. I've never seen a woman do anything more than raise her eyes to the ceiling in disgust on that particular point. Another point, I think it's salient also. X-ray is a well-known provocateur of cancer. X-rays cause cancer. We won't have to go too far down the lane with the work of John Goff. We've had him on our show many times. Original member of the Manhattan Project, served on the Atomic Energy Commission, who said that all cancers, of all cancers, at least 50% are caused by medical X-rays. And I think the mammogram is in that category of a number of individuals who didn't have a cancer, but very well could have had cancers provoked by the continual use of mammograms. I say especially at risk are those ladies who have a family history of breast cancer, where the old standards for sure, and I'm guessing that the OBGYNers out there, the obstetricians and gynecologists, if they note a history of that in the family, would use it to tell 20-year-olds and 30-year-olds that they need to have an annual mammogram because of their high risk. I think that in that special group of people, that they're probably the most vulnerable to having a cancer degenerated by the mammogram that they're getting every year, which could be, by the time they hit age 50, 30 years worth of annual exposure to X-rays, which I'd say is about 1 rad of energy per X-ray. 1 rad, actually it's 2 rads, 2 rads to either side of the chest, 2 rads to one breast, because they take a superior to inferior shot and an outer to inner shot. So there's 2 shots of X-ray given to each breast. So it's 2 rads of energy on one side, 2 rads of energy on another. It's 4 rads every time you get the study done. That's 4 rads of exposure. And John Goffman has told us that one only needs a lifetime exposure of somewhere between 5 and 20 rads. I hope that number resonates with you ladies, because it's an extremely large volume, large amount of X-ray exposure that I believe can potentially lead to the actual thing you're trying to avoid by using these mammograms. So keep in mind this 1 millimeter rule. It's served me well. It's helped me a lot in having discussions and weeding through the hocus pocus of mammography, because when you look at the cold hard facts, 1 centimeter, which is probably the size that is the earliest detectable, is actually 10 times higher than what it needs to be to rescue you. The third point that was raised by the task force, then again raised by the American College of Obstetricians and Gynecologists, was this issue of breast cancer self-examination, breast self-examination. That was one that if you just read into the task force said recommends against teaching breast cancer self-examination at all. I mean, don't bother. Hey, why would they say that? Because for a woman who discovers, and by the way, this is the way it normally happens, by the woman who herself can discover that lump, that she then goes to her obstetrician and gynecologist to have evaluated, the size of that lesion is usually well over 1 centimeter. And so there absolutely is no difference in survivability as to whether the woman detects the lump or not. The 1 millimeter rule is the rule that counts, not 1 centimeter or beyond, whereas mammography could probably eclipse that 1 centimeter restriction. Breast self-examination is usually much further beyond. And still, this breast cancer self-evaluation is something that's performed on a woman who has breast cancer awareness in mind at all times, and more than likely has been getting annual mammograms for a number of years prior. The mammogram from last year didn't mention a thing. This year, we got a lump which is well beyond the 1 millimeter rule, which consequently it takes you beyond the metastatic spread issue by a large margin, meaning that thing is after the races. It's already taken root in some other tissue, and that other tissue could be vital tissue that you do succumb to. No, nobody's ever died of breast cancer. They've died from metastatic spreads of breast cancer. The study that you use to try to determine what your status is with respect to it better be one that takes into account that 1 millimeter rule. And we're certainly going to be talking about it because there is absolutely a way to do that. Why don't we take a short break again? I need a sip of water. I seem to be lecturing today. Hey, I'm still wondering, can anybody tell me if you're driving through town, is the fountain pink? I may have gone off half-cocked. I don't think so. I think Breast Cancer Awareness Month is underway. I do think the fountain is pink. Someone verify that. 412-825-6262. Be back in a moment to talk about the kabuki dance of cancer. Be right back.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkaline minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine.
Hello, talking for Bob.
We offer metabolic nutrition tests.
This is Dr. Courtney. I don't have much time. I'm on the radio right now. Can you tell me for? Yes.
Allergy correction and host of
Okay. I'll be there. Thank you.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard on this Friday morning version. Hey, new month. It is October, starting today. There's good and bad to that. That's not really fair. Breast cancer awareness is a wonderful goal. But the tool that's being used to cause women to want to become aware is one that can't match up to what's really needed in order to get the confidence in knowing that you don't have a malignancy. I say by the time that they're detectable by mammography, you're already well past that 1 millimeter rule. Still listening for anybody to let me know about that fountain down there, which I'm assuming has turned pink. But let me take another approach to how actually you, ladies, already know about the fact that the metastatic spread, which I say has occurred, actually is proven over and over again by the conventional medical community that they already know that also. They don't actually say it, but they certainly do everything to indicate that things aren't okay. I call that the kabuki dance of conventional medicine when it comes with respect to especially breast cancer, because it goes something like this. Let's say that you get a mammogram, and let's say that a lesion surfaces on mammography. Okay, that's step one. Step two, you will be more than likely, after your gynae gets a hold of it and digitally palpates the breast tissue, a decision will be made, and it happens in the highest percentage of cases, that a biopsy, along with a lumpectomy, is what's in store for you. That's step two. Step three, the biopsy / at a minimum, lumpectomy, and at a maximum, sometimes much more than that, is attempted. And as the family awaits the surgeon's arrival in the waiting room, that scene goes something like this. Look to the family, and finally, when the patient is able to communicate, look to the patient, we got it all. We got all of it. So you can rest assured things are okay because I got it all. Now, I may have gotten it all, but you'll need to start your chemotherapy on Monday, and at that point, you look rather dumbfounded, at which point I find that the question doesn't get answered. Why is it, if you got it all, that I need to do chemotherapy? By the way, not just chemo, more than likely chemo plus radiotherapy. Why is it that I have to do it at all if, in fact, you're telling me that you got it all? Well, that's a little bit of a dilemma during the kabuki dance because I guess you're not supposed to ask those questions. But what it does is it shows that the medical community itself already knows about the 1 millimeter rule. And they already know that when the time comes to remove a lesion of it, even a centimeter, or usually 2 or more centimeters, by that time metastatic spread has already occurred. The chemotherapy is to try to deal with the spread. The radiotherapy is really crazy because it's directed at the breast itself, where supposedly you already got it all. This kabuki dance goes forth every single day in this country and is a testimony to how ill-equipped the conventional medical community is to being able to conquer this breast cancer issue. Yes, you found a lesion. Unfortunately, you found it well beyond the point where metastatic spread can't and shouldn't be considered. You already know that because you scheduled this patient whom you just finished performing a biopsy / lumpectomy. And the frozen section shows that this is cancer. So now you have a discussion with the patient and the family talking about the chemotherapy regime and the radiotherapy regime that you now recommend after you supposedly got it all. Yeah, you got all of the breast cancer lesion. That's gone. And probably not really gone because although they say that the borders, and they check and see that the lesion they removed has free margins, meaning that the cancer doesn't approach the margin of the incision that's made around it, all that still does not protect you against the metastatic spread, which will be the determiner as to what survivability means with respect to your particular case. Where that thing was spread to, I say the vulnerable organs. The very vulnerable organs are the brain and the lung and the liver, for the most part. These are the critical areas that do not respond well to any encroachment by malignancy. With respect to the brain, especially, very little forgiveness there. With respect to the lung, very little forgiveness because the patient can usually succumb to pneumonia because of the increased accumulation of fluid in the lung that occurs because of the presence of that malignancy. Anyway, I think we now can say that we have pulled back the curtain on the wizard. We expose the king in the middle of the street without clothes. And it needs to be hit home. I take this opportunity every year to bring it with emphasis that I rarely take the remainder of the year, but I'm hoping that I've triggered some thought processes to go on with all of you with respect to how best to handle this issue. Now, we're going to be talking about thermograms and up-and-coming shows. Ladies, hold off on that mammogram. Wait till you hear about thermograms. You decide. But I think it's an obvious decision that you're concluded to make if you just take the few points that I made today and mull over them. Look at the kabuki dance. Look at this 1 millimeter rule. Look at the limitations of self-examination as well as mammography. I think you have to conclude the same as even did these task force. I hear a knock on the door. Come on this door. Hello and welcome in.
Dr. Courtney.
Yes.
How you doing?
I'm doing good.
Hey, I got a question for you. Have you ever heard of a book called Poison Needle?
Poison needle.
Yeah.
I'm unfamiliar with it. Tell me more.
But however it is, there's a section in there that talks about breast cancer. It talks about that lump, okay? And it says that lump, that lymphatic gland, right?
The lump in the breast?
Right.
Okay.
That lymphatic gland should not be cut or radiated or burned. That lump is a protection shield. Actually, the poison is inside the lump. And that lump should not be cut because when it's cut, those doctors is not getting it off. What happens is that the poison is going to seep down into another spot in the woman's breast, and then what happens again? The body forms another lymphatic gland.
Okay.
Have you ever heard that before?
Well, I think I would phrase it a little differently. I think I know what you're on to. But I would hasten to use the word poison. This is malignant tissue. In one respect, yeah, it's a poison, all right. But in the other respect, this is a poison that's alive. This is a poison that grows, and wherever it should land, that's the problem it's going to then create. I have patients, plenty of them, breast cancer patients, that come to me. They discovered a lump, and they say, I go, okay, are you going to be getting a evaluation from a surgeon, do a biopsy? They go, absolutely not.
Right, you're right.
I'm not going to have it. And I have the same with my men who have prostate cancer. They are not going to have biopsies because of the very fear that it will actually cause the spread of a cancer, which is, if it's left alone, is raising a shield. However, there is metastatic spread even with that shield in place. I want to come back to the point I was trying to make a moment ago, which is at 1 millimeter, there's still a capsule. At 1 millimeter, you still have the opportunity to spread. If you go in there with a knife and disturb that tissue, you potentially have the ability to spread it to a greater extent. And I understand it. And the moment they tell me, I'm not going to get this, I'm not going to get that, and I'm not doing this, then I go, okay, let's talk about what you should do. And there's plenty to do. There is a non-toxic approach to the treatment of cancer, because we have to assume, if you're not getting a breast biopsy, that you're willing to take the assumption that it is a cancer and that we have to deal with it as opposed to not doing anything at all. But I thank you for the call.
Well, hold on. Can I have another question?
Go ahead.
Okay, that biopsy, you don't believe in that, do you?
Look, I feel that tissue typing is actually it's something I can't refute. I think getting the proper tissue type is important because it does allow for the conventional medical community to provide its recommendations with respect to the chemotherapeutic agents they're going to use. Do I like chemotherapy? No. But these patients deserve to get a full evaluation, even up to the point where that they see an oncologist and they discuss chemo. Now, I say once you go into that discussion, and I'm a little ahead of myself, there's two questions that need to be asked. The first question is, what's my prognosis with the therapy you're going to recommend? And what's my prognosis if I, repeat, do nothing at all? And the answer is, there is no difference in the prognosis. I think that closes the door on whether or not you actually should proceed with chemo based on what I already know to be the answer to the two questions.
Okay. All right. But you don't believe in the radiation or the chemo, right? You don't believe in it.
Well, the word believe is probably not the good word to use. The fact that it's loaded with so many inconsistencies that they're not worth the use of them. But let's take radiotherapy. I certainly agree with it when sometimes the cancers are so big that no matter which approaches you're taking, you have to debulk the cancer. In a case like that, I'm in favor of radiation.
Okay, well, let me say one other thing. However it is, I'm a nutritionist, just personally.
Sure.
Doing my personal studying. However it is, I had a girlfriend that had breast cancer, and she actually went to a doctor, and they had radiated her like twice. And I told her, haven't you learned anything that I showed you? So I made her stop going there and get back on a nutrition. Breast cancer went away in a couple of months.
Very good. Very good.
What I'm saying to you is that breast cancer is easy to heal. It is not hard to heal.
Well, we need to talk about. We're going to have another show. We'll have another show on what to do. Today's show is on what probably is what not to do, and I think we're pretty clear on the issue of mammography. I hear bongos in the background. I thank you for your call. Ladies and gentlemen out there, have a wonderful weekend. When you're driving through town, take a look at that pink fountain down there. I'm sure it's going on. I'll talk to you on Monday. Dr. Hahn is going to be with us until then. This is Dr. Dennis Courtney saying so long for AM Impact on your health.